Did you know that, right now, your body might be trying to warn you about something very serious, but in such a silent way that it goes unnoticed? The truth is that cardiac arrest is treacherous, acting stealthily and often striking without giving any clear warning. Imagine discovering that the signs were there all along, but were mistaken for fatigue, stress, or even minor discomforts that you thought were irrelevant. If you've ever felt that something wasn't right but ignored it because you thought it wasn't important, that could be a big mistake. These silent signs might be your body's only chance to alert you that a cardiac arrest could be just 24 hours away. But don't worry, because you're not alone in this. Today, I'm going to show you the 5 hidden signs that could save your life if you act quickly. Identifying these signs in time is the key to protecting yourself and avoiding the worst. Your life depends on it, and you can take control now. Think of your body as a super complex machine, like a luxury car. When something isn't working properly, it will give you some signs. In a car, it might be that dashboard light that comes on to warn you that something is wrong. In your body, the heart also gives its warnings. The problem is that, often, these signs go unnoticed or are ignored. And when it comes to the heart, ignoring them can be a serious mistake. Let me tell you a story. Joao, a man I know, has always been very active. He played soccer every week and took daily walks. One day, he began to notice a strange fatigue. Nothing too extreme, but it felt like, suddenly, he had no energy to climb the stairs or even take a walk around the block. He thought it was just because of a demanding job or age, since he was over 50. But his body was trying to say something. Joao continued his routine without giving it much importance. Until one day, while playing soccer, he felt a slight pain in his chest. Again, he thought it was just a muscle ache. Weeks went by until the pain and fatigue worsened so much that he decided to see a doctor. That's when the shock came. He had serious heart problems. If he had waited longer, the outcome could have been catastrophic. And just like Joao, you might be worried about your heart health, feeling that, despite all your efforts, you're not doing enough. With that in mind, I have a solution for you. Imagine if you could follow a clear and simple plan that, in just 30 days, could transform your heart health. Considering the challenges of maintaining heart health, I've made my ebook available, 30-Day Challenge for a Healthy Heart, 30 Steps to Clean Your Arteries in 30 Days, and I've left it for you to download right now in the pinned comment. This 30-day challenge isn't just about superficial changes. It's about ensuring your heart is stronger, your arteries are cleaner, and your life is longer and healthier. These are habits anyone can implement, no matter how busy their routine is. And the best part, these habits can be easily incorporated, becoming a natural part of your daily life. Click on the pinned comment, as we have very few units available and will soon be taking it down. Click now and grab your ebook. And Joao isn't alone. Many of us go through similar situations and think that minor discomforts are normal, the result of stress, fatigue, or even age. But the heart is clever. It tries to warn us, sending signals like chest pain, shortness of breath, extreme fatigue, swelling in the ankles, or even irregular heartbeats. These are the warning lights that the body turns on when something isn't right. The worst part, cardiovascular diseases are the leading cause of death in the world. And many of these deaths could be avoided if people paid attention to the signs their bodies send. We think these problems only happen to others, but the truth is they can happen to any of us. And it doesn't matter if you're young or old, active or sedentary. The heart doesn't send warnings for no reason. Remember, these signs can start subtly. It could be a simple fatigue that doesn't go away, or a little chest pain that seems innocent. But ignoring it can be dangerous. So, at the first sign of trouble, seek medical attention. There's nothing wrong with being cautious. On the contrary, it's the smartest way to take care of yourself. And when it comes to the heart, what's at stake is your life. So, stay alert. If your body starts giving these signs, it might be time to act and give the attention your heart deserves, because it's the engine that keeps everything running. Before we continue, for those who haven't subscribed to the channel yet, we will always bring content about how to take care of your heart health. Now we will reveal the first symptom that you may be having a heart attack. 1. Ulcers on the feet and legs. Are wounds that do not heal properly and can be a serious sign of circulatory problems. Blood circulation is crucial for the health of our bodies, as blood carries essential oxygen and nutrients to the cells. When this circulation is compromised, various complications can occur, including the formation of ulcers. Poor blood circulation, Conditions like atherosclerosis, where the arteries become narrow and stiff, hinder blood flow to the extremities. This can result in inadequate delivery of oxygen and nutrients, which are essential for wound healing. Venous diseases. Conditions like varicose veins or deep vein thrombosis can cause blood to pool in the veins, increasing venous pressure and making healing difficult. The constant pressure can lead to the formation of wounds that do not heal. Ulcers on the feet and legs can present in various ways. Visible wounds. They can range from small areas of broken skin to larger and deeper wounds. Swelling. The area around the ulcer may become swollen and tender. Color change. The skin may show discoloration, which can be red, purple, or dark. Pain and discomfort. Many people report pain in the affected area, especially when pressed or during movement. It is essential to seek a healthcare professional when noticing any wound that does not heal, especially if you have a history of diabetes or circulatory problems. The doctor can conduct a detailed evaluation, including physical exams and circulation tests, to determine the cause of the ulcer. Treatment for ulcers on the feet and legs may include local care, keeping the area clean and covered, using appropriate dressings to promote healing. Medications. The doctor may prescribe antibiotics if there are signs of infection. Lifestyle changes. Improving diet, increasing physical activity, and managing conditions like diabetes and hypertension are essential for improving circulation and preventing new ulcers. Medical interventions. In more severe cases, surgery may be necessary to correct circulation problems or treat the ulcers. Being alert to signs like persistent wounds on the feet and legs is vital for cardiovascular health. Early identification and proper treatment can prevent more severe complications and improve quality of life. Never hesitate to seek medical advice when noticing changes that may indicate circulation problems. Let me know in the comments what symptoms you have been experiencing. We can help you. 2. Edema in the legs and ankles. The swelling that speaks about your health. Imagine coming home after a long day at work. Your tired feet and legs feel a bit heavier than usual. You catch a glimpse of your reflection in the mirror and notice that your ankles are swollen. This swelling, known as edema, can be an important sign that your body is trying to communicate something to you, especially about your heart health. Edema is the result of fluid accumulation in certain parts of the body. When it comes to the legs and ankles, the situation can be even more revealing, as it is often associated with heart problems, particularly heart failure. The heart, our great engine, needs to pump blood effectively. When this doesn't happen, the pressure in the veins increases, and fluid begins to accumulate in the lower extremities. Think of your heart as a pump. When it is not functioning properly, it may start to struggle to do its job. This can happen for various reasons: diseases, high blood pressure, problems with the heart valves, or even a previous heart attack. This struggle leads to blood accumulation in the veins of the legs, which, in turn, causes edema. Moreover, other conditions can contribute to the swelling. The kidneys, which normally help eliminate excess fluids from the body, may not be functioning properly. Or the liver, which plays a vital role in filtering substances, may be compromised. In cases of pregnancy, women often experience this swelling due to increased pressure in the veins. Pay attention. The symptoms of edema can vary. You may notice visible swelling. Sometimes it feels as if your legs and ankles are asking for a break, appearing bulkier than normal. Heavy sensation. This feeling can be uncomfortable, as if you are carrying extra weight. Difficulty moving. Swelling can make even the simple act of putting on shoes a challenging task that once seemed so easy. Marks from accessories. When you take off your socks or shoes, you may find deep imprints on your skin, highlighting the pressure that retained fluid is exerting. Treatment for edema in the legs and ankles depends on the underlying cause. Here are some practical tips. Healthy eating. Reducing salt intake can make a significant difference, helping to decrease fluid retention. Regular movement. Light exercises, such as walking or swimming, can improve circulation and reduce swelling. Elevating the legs. When sitting or lying down, elevate your legs. This helps fluid return to the circulatory system. Medical consultation. Don't hesitate to discuss the use of medications with a healthcare professional, who may prescribe diuretics if necessary. Edema in the legs and ankles is a message that your body is sending. Ignoring these signs can lead to more serious problems, especially when it comes to heart health. So, stay alert and take care of yourself, so your vital pump continues to function as best as possible. I noticed you forgot to like the video. Show us you care about your heart health and leave your like. 3. Cyanosis. What it is and how to recognize it. Cyanosis is a condition where the skin takes on a bluish color, usually noticeable in the fingers, toes, lips, and extremities. This color change is a sign that the body is having difficulty adequately oxygenating the blood. It serves as an alert that something may not be functioning as it should in the circulatory or respiratory system. What causes cyanosis? Cyanosis primarily occurs due to poor oxygenation of the blood, and several conditions can contribute to this. Heart diseases. Issues such as heart failure or congenital defects can hinder the effective pumping of blood, leading to cyanosis. Respiratory diseases. Conditions like asthma, pneumonia, or COPD, chronic obstructive pulmonary disease, can limit the amount of oxygen the lungs can transfer to the blood. Circulatory problems. Inadequate circulation due to venous thrombosis or arterial blockages can cause a buildup of oxygen-poor blood in the extremities. How to recognize cyanosis. The signs of cyanosis are most evident in certain parts of the body. When you look at your extremities, you might notice fingers and toes. The bluish coloration is more pronounced here, as these areas are farther from the heart and may suffer more from poor oxygenation. Lips and tongue. Cyanosis can affect the mucous membranes of the lips, turning them purplish, which can be an important sign that something is wrong. Other extremities. Ears and the nose can also show this coloration, especially in cases of cold exposure or circulatory problems. What to do if you notice cyanosis? The treatment for cyanosis depends on the underlying cause. Some options include oxygen therapy. To increase the amount of oxygen you receive, doctors may prescribe oxygen therapy, which can be done at home or in a hospital setting. Medications. Depending on the underlying cause, medications may be prescribed to improve heart or lung function. Surgical intervention. In more severe cases, such as congenital heart defects, surgery may be necessary to correct the problem and restore proper blood oxygenation. Cyanosis is an important warning sign that should not be ignored. Recognizing the symptoms and seeking medical help promptly can make a significant difference in your health and well-being. Pay attention to changes in your body and do not hesitate to seek assistance if something seems off. And remember, if you're concerned about your heart health and want to make a change today, be sure to grab your digital book, 30-Day Challenge for a Healthy Heart, 30 Steps to Clean Your Arteries in 30 Days. It's very important that you get it right now before the units run out. Now, let's move on to the fourth sign of heart problems. 4. Xanthelasma, the story of spots around the eyes. Imagine looking in the mirror and noticing some small yellow spots on your eyelids. At first glance, they may seem harmless, but these little marks can tell an important story about your health, especially regarding your cholesterol levels. These spots are known as xanthelasma. Xanthelasma are yellowish plaques or spots that appear in the eyelid area. While they do not cause pain or discomfort, their emergence may be a sign that blood cholesterol levels are higher than ideal. These fat deposits can indicate that the heart needs a little more attention. Xanthelasma are easily recognizable. They usually appear on the upper eyelids, but can also develop on the lower eyelids, often symmetrically. The plaques are yellowish and can vary in size from a few millimeters to larger sizes. When touched, they are soft and do not cause any pain or discomfort. Although xanthelasma are not painful, they can serve as a warning sign. If you notice these spots, it's a good time to reflect on your cardiovascular health. This may include high cholesterol. Xanthelasma may indicate that you need to check your cholesterol levels. Blood tests are essential at this point. Heart risk. The emergence of xanthelasma may be related to an increased risk of heart disease, and this is something that deserves attention. If you notice these yellowish spots, consider scheduling a medical consultation. Here are some signs indicating that you should take action. Blood tests. If you have a family history of high cholesterol or heart disease, it's essential to get a checkup. Changes in appearance. If the spots change in size or if you experience any discomfort in your eyelids, seek guidance from a professional. When it comes to xanthelasma, treatment may vary. Monitoring. Often, the doctor may recommend just monitoring the situation, especially if there are no aesthetic concerns. Lifestyle changes. A healthy diet and regular exercise can help control cholesterol levels and, consequently, reduce the risk of xanthelasma. Aesthetic treatments. If you feel bothered by the appearance, there are options like surgical removal, laser treatments, or cryotherapy that can be discussed with a dermatologist. Xanthelasma are more than just simple spots. They can be a window into your cardiovascular health. Recognizing and understanding this condition is crucial. If you identify these plaques, do not hesitate to seek medical guidance for appropriate follow-up and to ensure that your heart is in good condition. Now, let's move on to the last symptom that may indicate you could have a heart attack today. 5. Extreme fatigue or shortness of breath. Imagine doing something simple, like climbing a flight of stairs, and suddenly feeling completely out of breath. This type of extreme fatigue and the sensation of shortness of breath can be signs that something is not right with your heart. The heart functions like a pump that needs to send oxygenated blood throughout the body, and if it isn't working properly, you may start to feel your energy fade away more quickly than normal. When the heart struggles to deliver enough blood, even the lightest activities can become a challenge. This may manifest as a lingering sense of tiredness that doesn't go away, even after resting, or even a tightness in the chest. Sometimes, this lack of oxygen can cause dizziness, making everything even more uncomfortable. These signs should not be ignored. They may indicate that the heart is unable to keep up with your daily needs. If you begin to notice this abnormal fatigue or shortness of breath, it's essential to see a doctor. A healthcare professional can perform tests to find out what is going on. In many cases, it may be something simple to treat, but it can also be a warning for more serious problems that require immediate attention. The important thing is not to put off these symptoms. Taking care of your heart should always be a priority. And stay alert. Taking care of your health is essential. You can start today in a quick and effective way. Just grab your digital book, 30-Day Challenge for a Healthy Heart, 30 Steps to Clean Your Arteries in 30 Days. It's in the pinned comment, so act quickly before the copies run out. Now that you know these warning signs, remember, your heart health is vital for an active and energetic life. If you found this video helpful, don't forget to like and subscribe to the channel. This way, you'll always stay updated on the best tips to keep your heart healthy and help spread this knowledge to more people. Together, we can take better care of our hearts. Until next time.